So,
and this is different than anything, any clinic around.
Workouts that are tailored for her, and that really makes a difference.
Really personal. I've gotten way more mobile, stronger, flexible. So everything just improves me to the next level.
Welcome to the On Cue Performance Therapy Podcast, where we push sports performance and physical therapy to its apex. We change the game by bringing together the brightest minds in the field to offer best practices and question how things are done today. I'm your host, Mike Quintons, physical therapist and expert in sports orthopedics. I'm living my dream and opened a clinic that unites all elements of sports medicine under one roof to drive recovery and performance outcomes.
What's happening, Performance Therapy Nation? This is Mike Quintons, your host of the On Cue Performance Therapy Podcast. I'm joined today by Dr. Marc Legere, chiropractor, good friend, has taught me so much over the last few years, and we even worked together for a little bit. So I'm thrilled to have him on the show. We're diving into the PT versus chiropractor thing. Marc has the patch technique, and what the patch technique is, I'm going to let Marc dive into that a little bit more. I've seen it firsthand. It works. Literally did it on me, on my shoulder, and felt like a new man thereafter, and I've seen it work. So I'm excited to dive into some of the chiro versus PT talk, as well as dive into the patch technique and the direction Marc's going. So Marc, I'm going to introduce you. I'm going to read through your bio here, and then let's get the ball rolling. So Dr. Marc Legere is an author, medical consultant, on-air personality, and chiropractic physician who is recognized as a worldwide expert in healthcare. Having worked alongside pioneering physicians in a wide variety of medical fields, he has developed a highly respected accessible therapy program, which allows patients to heal and recover far more quickly and with longer lasting results than with many of today's standard therapies. His extensive background and experience in the field of sports medicine has allowed him to think outside the box in regard to discovering the true source of physical injuries, which may have gone undiagnosed. I've seen it firsthand. It works. So Dr. Marc Legere, thanks for joining us on the show. This is great. I'm happy to have you.
yeah, thanks for having me, Mike. And I mean, you were way too kind. I mean, I wish I could, I need to give you as much kudos back, because I tell you, it's like having you as a clinical partner in that office was awesome. And it's something that I was so excited to have, because, you know, we've seen, just like you had mentioned, that there is a little bit of a divide. There's a little bit of a, you know, like, I'm not sure about this other profession. But what we found, and we saw this and it was proven with you and I, is that when those walls come down, you can actually do some really cool stuff. And seeing what changes you were able to make for your patients, and seeing what you were able to do, and it was above and beyond what I had ever seen with other PTs, and then be able to see, wow, we could really complement each other and really do what we do best. And if we both do that, then the patient's ultimately going to be the one who's going to benefit from it. So thank you so much for having me on. I'm glad that I miss you. I miss you in the clinic.
You and me both, man.
Because we got it. I got it. And not as many people out there are lucky enough to have that. So it's great to reconnect. And I'm really looking forward to be on the show. So let's get into this whole chiro PT thing.
Yeah, let's do it. You used the word symbiotic relationship. I remember day one when we sat in that office. I think at the time it was a Plymouth meeting, and you said, you know, I see this as a symbiotic relationship. We need to work together to get the best results. And I was like, heck yeah, that's awesome. Like, is there overlap? Sure, there's overlap. But this whole like PT chiro, you on social media, you see it, you know, on television, you see it all over the place, and patients ask all the time, what's the difference between you two? So I want to know first why, if you don't mind, why did you become a chiropractor?
Yeah, it's a great question. So it happened to be a lot of the times what they find, at least in the chiropractic profession, that there was a chiropractor who impacted your life. And really, that's what they said on day one of chiro school, is the majority of people who become chiropractors found a chiropractor that helped them out. And that actually was my story too. So I was an athlete in college and in high school, and I was always banged up. I'm a little bit older. I kind of just missed the .com and social media world when I was younger. So unless you had an expert coach or who was a former player at the pro level, at the college level, we didn't have the ability to go and see if we're doing things the right way, right? I was a pitcher, I could throw fast. So the coach says, throw fast. And it ended up doing a number on my arm. And I haven't had official MRI, but I probably have a torn UCL. I probably have a torn ligament in my elbow, and it would be killing me. And I was never able to quite get the right care. And eventually someone introduced me to a chiropractor who did myofascial release. And every time I'd go, I could pitch the next day. And I thought that was one of the coolest things. Like, here's someone with their hands was helping me. And so I had a couple jobs after I went to college. And it kind of was this fork in the road of like, what am I going to do? And it turns out that there was a chiro who lived as a neighbor of mine. And I just said, hey, before I totally make this call of what am I going to do, would you mind if I shadowed you? And he said, yeah, sure, come on over. So I shadowed him. And that day, and it was just totally coincidence, someone came in and it was this grown man and was crying out of happiness because this chiropractor said helped him, and for the first time in like months he could pick up his kid and play with him. And that's where it was. I said, it helped me. There it was, helping this person. This is what I want to do. And so I had to go back and take all these sciences that I didn't have in undergrad. I had to take my bios and chems and all that stuff. But that personal impact as for myself, and then seeing it with somebody else, really made me think, this is something that I want to do. So hopefully, partially, I can go back and fix myself if I was ever in that position, but also to hopefully have that type of impact on other people's lives. And so that's when I decided to enroll in my school, which really was like the least of the chiropractic schools. So there's ones that are, you adjust everybody, and there's ones that you adjust, but be a doctor, learn how to diagnose, learn other techniques. And I think that early introduction, that thought process had me thinking outside of straight chiropractic from day one. That's what had me looking at, what about strength and conditioning? What about PT? What about sports medicine? And what can we use from each one of those to ultimately get the best results for my patient? And it kind of morphed into my methodology and my desire to partner up with PTs, to work with strength and conditioning specialists, because I know what I'm good at, and you know what you're good at, and
Yep.
And a primary care doctor knows what they're great at, and an orthopedic surgeon knows what they're great at, and a dietitian and a nutritionist knows what they're good at. And sure, they kind of know about some of the other stuff. Like, I'll pick up like a weird skin condition every once in a while, and I go, I don't know what that is. That does not look right. Go see a dermatologist. They know how to do it. So what I found is when we kind of let everybody do their thing, that the patients look back to me as the person who helped and who was the fixer, not necessarily because I was the hands-on person, but I did my thing and I knew where to go. And that's where I really started thinking, this is much bigger than just straight chiropractic. I want to be someone who provides health or results or recovery for a patient, no matter how it works. And that's kind of how we get into it.
That to me is very similar to how I got into PT. I heard about it and I'm like, oh, let me shadow. And like, why isn't that done more often? And I think it's done a lot, but it should be done more. If you're passionate about something or you think you want to go into that field, you should shadow. And I thought that I wanted to work with athletes when I got out of, or in high school, and then I shadowed and I saw that like you can help the weekend warriors and mom and dad and Uncle Tom and Aunt Jean. Why not? Like, you should. And how empowering was that experience for you? That's great. What chiropractic school did you go to? And did you know that going into it that you were going to get a little bit more of a holistic view or approach?
Yeah, great question. So I went to a place called National University of Health Sciences, which was in Chicago. And in what I had that chiro who I knew said, he kind of educated me on that there's really two schools of thought when it comes to chiropractic. And actually this might lead us down another path here in a second, but there's what's called the straight chiropractic schools. And those are the ones that are, call it die-hard adjusting schools. Like it's adjust everything. And then there's the mixed schools. And those are the ones that are be a doctor, learn physical medicine. And I found that I asked, like, what's the one that's going to get me most ready for playing in a bigger pool? What's going to help me work with orthopods? What's going to help me talk the same language as primary care or a physical therapist? And people kept on saying to go check out National University. And so when I went there, we started learning from day one of like, know your anatomy, know your stuff, but also know your limitations and be really good at what you're good at. And so that's kind of where I learned early on that was a great path that I chose. But like I kind of mentioned, is like one of the biggest struggles in my career, my profession, is what I call the bad chiros. Or it's a negative connotation because of where the profession was in the past. Some of the terminology that chiropractors use to explain what they're doing. And some of that terminology really rubs other professions that are in the medical field the wrong way. I mean, I'm putting the bone back in place. Like that doesn't happen. Right. But that's what they use. That's what some chiropractors use to explain it to a patient, because I don't know, maybe it's a simpler way to explain it, or I don't know what, but when a orthopedic surgeon hears from the patient, oh, the chiropractor said he's putting my bones back in place, their heads are exploding. And I remember I shadowed an orthopedic surgeon right when I was kind of going through things. And he said, Mark, the only time a bone's out of place is if it's dislocated. And if you dislocated the spine, you're not coming to my office, you're going to the mortuary. I mean, like, you're going to the morgue, you're not coming here. Yep. He goes, what is an adjustment? And I said, well, let me think. And I was like, well, what my school taught me is that an adjustment's a stretch, and use it that way. If someone has restricted motion, it can help get more motion. But you wouldn't want to use motion for someone who has already too much. That would be counterintuitive. So use an adjustment as a stretch. And if you explain that to a patient, if you live in that world with the docs, a lot of those barriers will be lowered, and then maybe you're going to be more accepted. And so that's where my mentality from the beginning has been, an adjustment's just a stretch. That's it. So how can I use that or other things to complement it? And that's all I'm going to do. And because that scope is small, it's very focused, that leaves a lot of other stuff that I need the help of physical therapists. I need the help of orthopedic surgeons. I need help from a lot of people. But what I know is that if I live in my world of hands-on medicine where I want to help improve range of motion or reduce pain and range, I'm going to have done my job, and I'm going to be able to help. But there's all those other components that I need to work hand in hand with physical therapists. So like I tell people all the time, my biggest challenge is getting that word out, is to undo the damage of other chiropractors who are saying the bones are out of place, or a lot of them use these other terms where, and this is it sounds bizarre and I don't get it, but there are some chiropractors out there who will say, I'm going to check on your vitamin deficiency. So it's a term where they do what's called applied kinesiology. And what they'll do is they'll say, all right, hold out your arm or hold out a body part, and then they press on it. And they go, oh, that feels weak. Take this bottle of vitamin C or a vitamin, hold it near your heart. Now I'm going to press. Oh, look, it's stronger now. Right? Like they're claiming that they can do that. And so to me, it's like, this is crazy. Like that can't work. But you're telling patients that's the case. And then they're saying, oh, my chiropractor. So my biggest thing is when I go to talk to someone, I'm a chiropractor, but I don't do straight chiropractic.
That's got to be tough to overcome. Like I hear always, and listen, PT is far from perfect. I've spent plenty of time on this podcast saying that there's good PTs and there's not so good PTs, and the reason for not so good PTs is a wide range of things, volume, burnout, etc., education. I'm doing it because my CI 15 years ago told me I should do it, but that's got to be tough for you, I would imagine, to feel, at the very least, to feel like you're constantly having to undo another professional's mindset or prerequisite notion that chiro, they adjust and they do things that aren't as ethical, like maybe some would say, as other professions. That's got to be tough.
Yeah, it is tough. But what I find is that when I find and make a connection, for instance, with you, the first day I came in and I got introduced to you. You came in with an open mind and you said, let's talk. And that's where, when you can do that with fellow medical professionals, give me 5 minutes and you'll see I'm not nuts. And you're going to see that what I do makes sense, and that you'll see if we can work together, we can do some really cool stuff. And so it takes an open mind, but it takes an open mind from both ends. But when you can do that, then you can start to see it. And then ultimately you have to prove it, right? You can't just be like, I'm a nice guy. You have to have something that actually works. And ultimately it's the patients who tell you that. The patients are going to say, hey, I like this experience. And I would always hear it, and I'm sure you did too when we were working together, is why don't more people do this? Why aren't more chiro PT working together? And that kind of, I think, and this is just my opinion, is that we're so close. There's so much similarity there is, that in the chiro world, I think that chiros want to do more, whether it be for helpful reasons or they need to do more for financial reasons. And they start trickling out of chiro and what their chiros are good at, and they start to get into some PT work. And the same thing may be true with PTs, where
it is true. You can say it is true. Yep.
So what I find though is that if I do what I do best and send off to you to let you do what you do best, ultimately it's the patients that are benefiting. But it takes some clinical confidence to know, like, it's okay that I send someone away. Like, it's okay, they're going to come back. Or this person's not going to say, thank goodness you got away from Mark, he's nuts. I know how to best do it. It's like clinical confidence in your co-treatments. But when you can do that with a similar message, then ultimately things really start to pay off. But it's kind of like you kind of have to dance, right? It's like you sort of have to have trust in your partner in that clinical dance. But if you both do what you do best, ultimately over time, it's going to prove itself. And then it starts to have a reputation. And that's really when things become cool. Is like, go to Mark and Mike, no matter what you got, they'll help you. And then they come to one-stop shop.
Yeah, no, you're spot on. And we saw firsthand where anytime you refer somebody to somebody else, whether it's a physician, chiropractor, dermatologist, whatever, it's a reflection on you. And I think the challenge is, and we speak the same language, so I think the challenge a lot of people is I think it's ego. You got to put your ego aside, and the second thing is trust. That Mark's going to do the right thing, that Mike's going to do the right thing when they get that patient, and not step on each other's toes. If there's something that Mark's good at that you need to go back to Mark for, go for it, right? If there's something Mike's good at, you need to go back to Mike, go for it. And there were times there was overlap in that they would see you, at 10 o'clock, and they would come out and see me at 10:30 or 11 o'clock. And there's no need for me to do any soft tissue or joint per se. It was, let's get into the stabilization stuff. Now we can be more efficient with that because you've handled a lot of the, soft tissue or joint related stuff. So let's talk what works, right? So tell me about the patch technique. This is your baby. I want to hear about it.
It is. So patch technique it came out of necessity and for me personally, and out of a way to help more. So when I graduated, right, so I wanted to do more than just adjusting. And the practice that I joined, they were great, but they were that straight chiro practice. They were adjust. Patients enjoyed it. But my goal was always to get into sports. And so I started taking courses like active release technique, which was like a mind blower to me. When I took ART, I came back and I put it into place that first day. I was like, I want to try this. And patients really started liking it. I loved the response. And I thought, an adjustment just being a stretch wasn't changing soft tissue. It wasn't making long-term progress. And that's why sometimes people need to go to chiros forever. And so I wanted something that was changing tissue. And that's what ART was. But ART, as you know, and as other ART providers know, it can take its physical toll on the provider. And I developed trigger finger in my right thumb because of it. I was starting to become concerned because I didn't want to have to go back and just being a straight chiro. I wanted to do manual therapy, but I couldn't keep hurting my thumbs. And so I started just trying to learn and to talk with people and to think outside the box of like, okay, I love what ART did, but what can I do that maybe would be different or an alternative that would achieve the same goal? And so luckily I started working with pro athletes. I was doing that up in New York City. And over the years of using patch technique, I've treated over 1,000 using it. But it started off with, hey, can I try something different for you? And as you know, athletes, you tell them to stand on their head. If they think it's going to work, they're in the corner standing on their head. So I'd say, well, let me try this. What do you think about that? They go, I don't like that way. How about this way? Yeah. So I tried to come up with like some big differences of things that I thought would be better or easier. So I wanted to avoid my thumbs. I want to use my thumbs, but what else can I use? Can I use my fingers? I mean, we're built to grip a lot more than we are to put pressure with our thumbs. Could I use my elbow? Yeah. So all right, now I got 3 different ways of going after it. So my thumbs are preserved. And then I kind of looked at things where, well, in some of the other moves, if it was active and it hurt the patient to move in an active position, they're not going to want to do it. So what if I made it passive? If I did it passive, they're going to relax. I can treat deeper with my different contacts, and I can move them through the range that I want to do. And the body feedback of the tissue underneath my contact hand would tell me what's going on to the injury. And so I started coming up with more and more. And I'd start using them on the guys, and it gained a reputation. And guys for a while were like, go see Dr. Marc, he does ART. I go, time out. I don't do ART anymore. This is something different. And to the athlete, it was new to, they didn't understand the differences. So then I was like, well, I got to name this thing. And I want to make it something that it could be understood and heard and have the letter P really in the name, because I wanted to show it was passive. So I wanted passive in the name. And then I just started going through, and it's funny. One of the things I wanted was .com. I didn't want .net, .org, I wanted .com. So I started just playing. And then all of a sudden I was like, patch. Yeah, I kind of like that. It's easy. It has P in it. It's, you could say, oh, I'm patch certified in patch technique. Yeah, I like that. So I trademarked it, which was this whole process of getting it trademarked, but to protect it. And so what I wanted to do was to have something that basically only I could do, or only people I train could do. And so it's a passive form of myofascial release, over 300 different contacts throughout the body. So I see all the way up from the head down to the toes, plantar fasciitis, tennis elbows, things like that. But that's really, when my appointments, that's all I really do. I may adjust if it's clinically necessary, but I lead and finish with patch technique. And that's where I live. I live in pain and range through patch technique. But like we said earlier, that leaves so much else to be taken care of. And I'll tell patients, look, on day 1, when you come to see me, my job is pain and range. You come to me, for instance, for a non-traumatic injury. Unless you see PTs, you're going to be back in my office in 6 months. So here's how it's going to work. I'm going to try to get you out of pain and move you. We're going to co-treat, and then I hand you off and you finish off with PTs. And that's where, when I'd love working with you, Mike, is that clinical powwow when we would walk out and I'd go, all right, Mike, here's what I found. What did you see last time? Am I looking at things right? Is there anything you want me to focus on? And then you would treat and you would start to see results, and you'd report back and go, hey, take a look at this next time. try this. This isn't working. This is cleaning up well. So we're clinically going back and forth, and the patient's just looking at us talking, and they're saying, wow, like two people both looking at me from a similar but yet different way. That's a win-win. It's 2 for 1. So that's kind of what patch technique turned to be. And that's where, my main thing is teaching the gospel or teaching the word of patch, and just trying to get the word out, really.
Yeah, so love it. That's a fantastic explanation. I would, if I could describe what I've seen you do, what I felt you do, that's exactly it. What I'll add to that is people hear myofascial release or ART. So ART is active release technique, like you mentioned, and it's the action of, and I've never taken a course, I've spent 200 hours under PTs learning ART, but it's the act of applying pressure towards, restriction on a version of a muscle in a directional force, and the patient or individual actively moving themselves through range of motion, as opposed to what you do is that you would move the limb in the desired direction you want to take it. And what's unique about that is, for example, the pec muscle. Pec muscle is a fan-like muscle, which to stretch it, you could go up here, you could go out to the side, you can go. So there's so many different ranges depending on what fiber you're applying force to. So therefore, if I'm applying force to the pec minor, I'm going to want to go at a different angle than I would straight across. And that angle, maybe we're talking 5 degrees, may make a difference on one fiber of the pec minor versus another fiber. And you're able to move that yourself because you know that. And what else is unique is you're addressing where the deficit restrictions are, not beating the living heck out of a muscle that is irritated or damaged or strained. Massaging the living heck out of a muscle out of a rotator cuff muscle isn't going to necessarily facilitate, maybe to an extent, some healing, but it's not going to, it may not fix the problem. The strain is still on the tissue. You're looking into addressing the restrictions elsewhere that are reinforcing the strain on that tissue. That to me was like, when you had told me about that, like, why are you working on here when my issue's back here? You're like, no, we're taking the stress off of that tissue by working on this tissue. Does that make sense? We're putting things in better positions so they can function better. I was like, mind blown. That's how I treat now.
Yeah, antagonistic muscles, right? I mean, it's like one of my sayings is like the 360 joint. You can't just treat on the site that hurts. You got to clear up everything, because you don't know why it's a strain or why you have pain there. It could be local, but it could be compensation. It could be restricted motion somewhere else. So you have to look at it. But really, in a clinical world, though, Mike, I know that my scope is really narrow, right? I know what I'm good at, and I know what patch technique is good at is pain and range. And so it's very specific. So it's not going to fix everything, but it's going to certainly help. And so that's where there's that clinical PT chiro world can really be blurred. But when you can use something that is a unique skill that's proven to be different, right? It's not something that anyone can do or patch technique, because I haven't taught anybody, but that if you can use that and from a PT side go, look, Marc's got it. They might need more manual, and I have my ways of doing it, and I'm going to add that as a complement it, but that allows me to spend more time with the function, strength, movement, proprioception, all those things that often contribute into it. That's going to make all of our jobs better. And I'll admit it to a patient. They'll say, like, what exercises do you recommend? I say, time out. I have no idea. Let's bring in the PTs and talk to them, because I don't know how to do them. I might know 1 or 2 good stretches that are my go-tos, but look, that's why we work with PTs. Let's get you into them. Let's talk to them. They're going to tell you what's up. That's their clinical expertise. That's not my clinical expertise. And ultimately, again, patients like that.
Yeah, I was just going to, patients, what you're doing there is by being transparent and honest with the patient, you're developing trust. And I think that trust is why you're as successful as you are, because you're transparent, you're honest, you're new, and you're doing what you're good at, and then you're passing off to a PT that you work with or trust. And to me, I think that's the buy-in that I saw when we worked together, that patients would see you and literally all of them would go to PT, scream to me that your patients trust you. So kudos, man. That's cool. From a business perspective, I feel like this is one of those. Well, chiros get business in school and PTs don't. I have no idea how true that is. And again, you may have gone to a slightly different school than some, other chiros. How much is business pushed in chiropractic school, or maybe during your experiences after chiropractic school? And how do you feel like that's been an advantage or disadvantage?
So the chiro schools, they'll admit it. I mean, our school did that. Historically, chiro schools or medical schools, or I don't know, I can't speak to physical therapy schools, but have not done a good job of preparing the doctor for business, because we have student loans we have to pay, we have bills we have to pay, we have utilities, and we have all those things. And so they tried to do some stuff to help us. They had us write business plans. They kind of had us think like, what could make us unique from other people. That's where I started. Let me learn Graston. Let me learn these other techniques that would make me unique. But one of those things where it's interesting in my career, as I look back, when you're in something, you never quite know why you're doing it or if it's going to help in the future. And it's interesting. One of my favorite quotes that I learned early on was from the Dalai Lama. And it was like, too much attention doesn't let you see the reality of the situation, which is like basically when you're in it and you're like, I don't understand why this failed. This is frustrating, but it plays out in the future when you get some time to step back. So for me, when I graduated college right in the beginning of the .com time. So it was like companies were sprouting up out of nowhere and were doing great and then would collapse like 6 months later. And so I was joining companies where prior to taking the prerequisites for chiropractic school, I was like a communications and marketing major. So I was in marketing and sales roles right out of school. So I was a drug rep. I worked for a company that developed a mathematical model to predict crime. It's crazy. I worked in an advertising agency. I worked in telecom. So I had this interesting background, and it was so frustrating at the time that like I'd worked at the largest telecom company in the world. It's called WorldCom. And it was like huge. And then after being there for like a year, I had worked my way up. I was successful. It's the largest bankruptcy in like business history. And then I'd work at another, and I'd work as a drug rep. And I would work. And I'd be like a really good drug rep. I was number 3 in the country in sales. And then the drug I was going to get didn't get approved. And it was like, whack. And it kept on having all these things, but it was in the business world that would force me to think business wise. And so when I went back to school, I went back to chiropractic school on the older side. I started at 30. So I had graduated, worked at 22. So I worked for 8 years prior to going back to chiropractic school. And that real world experience started teaching me like dollars and cents. Like you got to pay bills. Like you have to differentiate yourself. You have to have something that, that you're passionate about. Otherwise you'll burn out. So I had those things. And so when it came time to graduation, that's where I started to excel because I kind of knew the world that I was getting into. And other chiros who graduated didn't have that. They kind of graduated and would join a practice and kind of getting taken advantage of, or they try to start their own clinic, but didn't have the business expertise and it would fail. And then they'd be kind of scrambling. So I felt like once I graduated, kind of had a better business sense of like what I needed to do. But for me, knowing kind of how business is, and the key is overhead, right? Overhead is like the crusher for most groups, that I wanted to find a different way of being able to provide my care and have a successful practice without the crushing overhead. And that's where I started working with different providers, working with physical therapists, and let's share space. And that model would allow, again, a new thing for us to offer, and it would reduce my overhead, and it would give me a clinical partners, and it'd give me something unique to sell or to talk to the doctors about. It would give me a unique conversation for the patient. and it separated me. So all those things and the struggles that I learned early on are things that I applied now to my own practice. But it's something that the orthopedic surgeons who I'm friends with, Chris Dodson, we both know Chris, he admits it. He's like, and he's an orthopedic surgeon that treats tons of celebrity athletes. He's like, I don't know the business side of things at all. And so it's tough. So to navigate your way through that's difficult.
Do you have any advice for, or one piece or two pieces of advice for any young chiropractors coming out of school, or even for PTs coming out of school in terms of the business side of things? Because you're right, you got to pay your loans off, and you're going to have bills and so forth. And by the time we get out of school, I'm sure same in your profession, you're like 28, 30, and that's if you came right through. So I was in school for 7 years, 4 undergrad and 3 in grad school. And I know you had a little bit of a later start. So the demand for an income is there. So any advice?
Yeah, I'd say that depending on whatever route you were choosing to go down, if you choose to go down the route of working in an existing clinic or working with somebody or even starting out on your own, never be ashamed of billing for what you do. I mean, that's one of the big things is you went to school, you spent a lot of money, a lot of time, you made a lot of sacrifices. I remember sitting in the library and looking out on a Saturday morning, beautiful day, getting a call from my buddies at home saying we're going golfing. And I'm sitting here studying for a neuro exam, thinking this better be worth it. But it is. So you should bill for what you do. Don't just give away those services. You would never expect to walk into a Starbucks and get a free coffee because you're a nice person. It took a lot to get that coffee there. They had to grow the bean and ship it across, an ocean and roast it. And I mean, bill for what you do, and never be afraid of a patient pushing back. One of the funny stories my father, who's a dermatologist, shared with me, because he explained the same sentiment, was it's a little joke, but it's a story. Is a guy takes his car to a mechanic, and he says to the mechanic, "My car won't start." And the mechanic goes, he looks over it and he kind of scratches his chin. And he goes, "Okay, yeah, hold on a sec." So he goes into the garage, comes out with a sledgehammer and smashes the engine. And he goes, "Fire it up." And the guy goes over to the car turns right on. And he goes, "That's incredible." And the guy goes, "Yeah, no problem. Let me get your bill." And he gives him a bill for $1,000. And he says, $1,000? All you did was hit my car with a sledgehammer. And he says, "Let me itemize it. Swinging sledgehammer, $1. Hit the engine, $999. Right? It's like, don't be afraid to bill for what you do. So that's one of the first things. And then the other one is just more of learn, get certified, learn as many different ways of helping people that'll differentiate you. If you looked up somebody who was a new grad from PT school, first of all, no one knows the differences between the PT schools. Like realistically, no one's going to know the difference of one versus the other. So to a patient, you're a physical therapist. Most of them won't ask you, maybe they will. But where things start to really differentiate yourself, which makes you more hireable, which makes you a better provider, which promotes you within wherever group you're trying to go, is ultimately the knowledge that you can impart for a patient. And that comes from coursework. So taking any type of additional coursework, whether it be get your hands better, get your diagnosis better, understand how to, like, whatever it is you want to do, reading x-rays better. Those things will help differentiate you and will give you extra check marks that you can share and promote yourself with. That now, if I'm a person who's hurt and I go to this website or look at this person's profile and they say graduated from PT school and is a provider, or graduated from PT school and is certified in this and that and this and that. I don't even know what those mean, but that person's learned, and that's the person I'm going to go to. And that's how you'll ultimately get a nice following.
Love it. I love it. I say it all the time. Invest in yourself, especially right out of school. Invest in yourself. Study, learn techniques, learn what works, learn what doesn't work. Googling online and looking up articles isn't going to help you get there. I think you have to tap into coursework, talk to people who've gone through it, reach out to contacts. When someone in PT school calls me and they have questions they want to shadow, heck yeah, come on by. COVID makes that a little bit challenging, but nonetheless, I'm more than happy to help and ask. And what's the worst that could happen? The person says no, I'm not interested in helping you out. Okay, call the next person. So, that's something I'm sure you've learned, in the business world that you went through before chiropractic school. You and I went marketing together dozens of times, and I remember going in an office with you, and you were right on it, and that helped you. Those experiences helped you not have any, you didn't second guess yourself when you walked into an office. You're very confident, and you know how to speak to physicians because you're, a doctor yourself. You have a doctorate degree in chiropractic. So you're very confident in your abilities. And I learned a ton from that. Walking in, you would speak very, very confidently, where other PTs I would have gone out with, maybe would have been like, okay, here's some stuff, pass it along if you can. You came in with a purpose. And so that kind of just reinforces, be confident in your abilities.
Yeah. And let me throw one more recommendation out there, Mike.
Love it.
That ultimately, when I look back in my career, from everything that I've done, the best things that I've ever done was just asking. Like you said, call up those phone numbers and call those people. But really, for me, the biggest things have just been like literally cold calling into some group and go, hi, I'd like to do this. Is there someone there who would talk to me? And I might get 5 no's, or I might get a no response. But some of my biggest successes have just been by asking. And it's literally just calling in and saying, I think I can help you. Can we talk? And you start that relationship, and it grows. But just asking, just ask. Can I shadow you? Sure. Sure. All that stuff.
Yeah, that's what I love that. That is that's great. I'm who I brought up to you earlier before we started recording. She asked me if I had any ideas for church when I was in PT school, and I said I would love to do something with mouthpieces and concussions. Some mouthpieces say that they reduce trauma to the brain and so forth, but they don't necessarily stand by that. It's not on their whatever. It's not something that they push. And I said, well, what should I do? She goes, what do you think you should do? And I'm like, well, I can ask these different mouthpiece companies to see if they would be willing to work with us. She's like, get what you don't ask for. And I was like, whoa, can't get what you don't ask for. And she's like, what's the worst that could happen? Tell you to go for a walk, they don't get back to you. Like the fear of rejection in our society today. I mean, to dive too deep into that, but I think limits some great experiences and opportunities. So I love that. I'm so happy you brought that up. All right. If you were to change one thing about chiropractic medicine, what would it be in your opinion?
So I'd have to go in my Wayback Machine and go back to the very beginning of chiropractic in general. Interestingly, that the chiropractic profession and the MD profession and the DO profession were all kind of getting started about the same time. The difference is that the MDs and the DOs got their act together and chiros were scrambling. And so that scramble, unfortunately, has muddied the water for so many chiropractors and the profession in general. I think that if early on chiros would have said, we're non-medicine based hands-on doctors, that's what we are. I think that could have been a great thing. That could have been a niche. It wouldn't have stepped on the MDs or the DO's toes. It could have been something that was helpful. I mean, chiro is chiral for hand. So it's like hand practor, right? Hand provider. So if that could have happened, the reputation would be there that we are hands-on conservative physical medicine doctors. And so that's where one of those things that if I could change the message so that I'm not having to undo what a lot of the other chiropractors have said or how they have these little offshoots where, to me, it's like, if you wanted to get into nutrition, be a nutritionist. Don't be a chiropractor who does a nutritionist, just like you wouldn't be a cardiologist who does podiatry. Like, narrow the focus and have a singular message and stick with it and focus on it. And the profession, unfortunately, there's infighting amongst themselves of what are chiropractors. And I think it just draws the whole thing down. I think that the profession needs to look more into really what are we? And again, I think we're hands-on physical medicine doctors. And if we stuck with that, I think people will be fine with it. But it's a struggle to undo the messages from other people and the reputations, and just kind of give me a shot, give me 5 minutes to talk, and you'll see I'm not crazy. You'll see I can really help. There is something to this, but it's to undo all the negativity of that negative connotation of backcrackers. And there's, again, schools of thought where they're like, oh, well, the nerves to the stomach go through this section of the spine, so if I adjust that section, I'll calm my upset stomach. And that's the people trying to undo that message to doctors. And so it's just, that's one of the biggest frustrations that I have with the profession, that it's something I don't see changing in my career, in my lifetime. Maybe it will, but I think that's something that definitely is the biggest drawback in general for the whole thing.
Do you think schools, do you see that, has that changed curriculums as of late? And I'm not sure how in tune you are with it. I know you have chiropractors that work with you and have learned the patch technique. That's something that you are willing to teach. Chiropractors, to my understanding, per previous conversations. Do you find new grads out of school are learning differently? Do you feel like that same message, 30, 50 years ago, whatever, is kind of continuing to be reinforced? Have you seen it change?
That's a great question. So my uncle is also a chiropractor, and he graduated, I think it was called the Philadelphia College of Straight Chiropractic or something, or Philadelphia, Pennsylvania College of something along those lines. So back in the day, everyone was a straight chiro. Adjust. Anti-medicine, anti-establishment, like crunchy, right? Like, fix the body. The body's innate. They use this term, innate desire to be healthy. You're helping it do that, helping get out. That's the old way. I'd say that now there is literally different schools of thought, like that mixed schools, and there's the schools are transitioning more to that mentality. There are the older ones, but some of the chiros who I'm talking to, who are even coming from the straight chiropractic schools, are looking at things differently now. They're looking at it like, like research really, that evidence-based doesn't really show that there's this innate thing that's happening. But evidence does show that by using instrument-assisted myofascial release, that it does work. And that, I think, is changing that momentum, and for a good reason, in a good way. So I'm seeing that it's making that change, but there still are out there those diehard groups. There's one that's not far from where I am. That's it's called Atlas Chiropractic, and so there's a school of thought that you adjust the upper neck bones of the neck, and because all the nerves come through that segment, that you're helped throughout your whole body. So they're still out there, but I think that I'm starting to see that change, and I'm very happy that that's happening, because the more of that right message that gets out there, the more willing I would believe that PTs would want to work with chiro, or that orthopods would be willing to work with chiros. And the more that the traditional medical establishment is also looking into alternatives, right? They're looking at more conservative measures. I think that with them looking into alternatives and the chiropractic profession getting less crunchy and getting more evidence-based is going to really make a difference. And our class, when I graduated, so I graduated chiro school in 2008, was the first class to have evidence-based practice as a course.
That's fascinating to me. That not until 2008 was that something that was pushed in chiropractic school. But nonetheless, so my cousin will graduate in May from a chiropractic school. I forget the name of it. And actually he came out and chatted with me yesterday. And it was cool. He was talking about special tests and was there a leg length discrepancy and was that an upslip or a posterior anterior innominate and asking about soft tissue restrictions would be and like very mechanically oriented understanding of the body as it relates to the spine and even into the limbs. So I want to address after hearing him talk about some of the extensors of the wrist and talking about the elbow and so forth. I want to kind of address some of the all right, PT, chiro, like who's allowed to do what, right? So ordering imaging, I can tell you PTs in outside of the military cannot order imaging. Can chiropractors do that?
Yep. So that is, for the most part, in most states, if not all, we have the ability to order prescripts for X-ray, MRI. Some places we can do blood work. In some states, we're allowed to do some injections, like a prolotherapy or something along those lines.
Okay.
We are able to make a diagnosis, so we have that direct access. Now, Mike, maybe you can. Yeah, I want you to clear that up for me, because that was thing I learned was that can PTs make clinical diagnosis of like official, like here's your diagnosis, or does it have to come from a doctor now? And like, because when I graduated, I thought that it said like, oh, PTs can execute, but they're not allowed to diagnose. Has that changed?
That has changed, and to reinforce what you were saying, it's all based on for our listeners, state to state. Every state's a little bit what law and what they allow licensed practitioners to do in their respective states. So in the state of Pennsylvania, and I think all the states, there's one in school, I think it was Indiana or Illinois, where PTs can diagnose through direct access, meaning an individual can walk in PT clinic and say, I want care, can you provide it to me? Before direct access, you would have to go to see a physician who would give you a diagnosis and a prescription, and then the physical therapist would execute that prescription. So the way it's in Pennsylvania, at least, and most states across the country, is depending on the insurance, you are able to treat somebody off of the street, so to speak, provide a diagnosis for 30 days. So per body part for 30 days, you can treat that individual. And most insurances, there's one in particular I know that doesn't, but most do. You can treat that individual and get reimbursed by the insurance company. Beyond 30 days, you would need to see a physician to get a prescription, or physician's assistant, whatever, to get a prescription to continue treatment. So direct access has been a very strong push in the PT world. I can tell you, quick 2 cents on it. I think autonomy is very important. I think it allows PTs and both chiropractors to use skills that we have, that we should be able to use. However, I don't think what's pushed enough is, I don't know what the diagnosis is. You're going to need it. I'm not touching you because you fell down the steps. It's not appropriate for me to do anything with you until you get an X-ray. So therefore, or you're in a car accident, I'm not touching you. You need to see a physician first, and I can help facilitate that conversation with the physician, let them know why I didn't, perform any treatment. So, when to refer out, I think is not taught enough. And who do you refer out to? As a PT, I can tell you personally, and pushed enough in PT schools. Autonomy is pushed. We can treat patients directly is pushed hard, and rightfully to an extent. But we have to also know, with that, we have to know when to refer out. How is that similar or different to chiropractic?
Yeah, so in chiropractic, we have the direct access, and we're lucky we don't have that 30-day limitation. So that is one of the rare things that I think that is an advantage, or it gives us, at least not an advantage, I want to say, it's nicer that we don't have to then chase that script. But yes, we have the direct access, which is nice. And then we can treat however we wish. In some states, we can refer to PT. So I know in Pennsylvania, I cannot, but in New Jersey, I can. It's that autonomy, and I don't know why one state is that way and the other one isn't. But yeah, so we have, it really varies from state to state as far as our scope of practice. We can build different codes. I know that from what PTs can. The one really is some of our diagnosis codes may be different, but then the ability to write a code specifically for adjusting, that would be different too. So where a PT might call it a joint mobilization, Chiro calls it manipulation. If you ask me, they're both basically the same thing, which is fine. Yeah, so we can write specific for different codes, but there's really no reason why people just can't come off the street. And then it's up to that doctor to know their scope. And actually, Mike, that's kind of jogged my thoughts, it's just a great point to what you talked about is referring out. Like you said, if someone comes in with a motor vehicle accident, I'm not touching it. One of the biggest problems or misconceptions of chiropractors is they create strokes. That is a common thing you'll hear out there. And what the research shows, though, is that the chiropractors don't create strokes. The problem is that chiropractor didn't do a good history and refer out. So the symptoms of a stroke is neck pain. So I have neck pain, I go to a chiropractor. The chiropractor should have done a better history and seen, you're having a stroke, go to the emergency room right now. Instead, they adjust. And then the headache, the neck doesn't feel better. They eventually might have a stroke, and they find out, oh, they went to a chiropractor. So again, it's knowing your scope. Don't overtreat. Know your limits. Send them out when you can't have it, but know when and how to send them out.
Yeah, that's a great point. And I've learned high-level motivations. I also call them a stretch. We call them a quick stretch as opposed to a longer duration stretch for the hamstring, for example. A quick stretch for the hip joint is going to be different. It's a quicker thrust, I would call it. Chiropractors have the term adjustment. I don't use that term. In fact, I'm not crazy about using the term manipulation for PTs, but we want a grade 5 mobilization, which is a high level thrust. And research has shown that in terms of neck mobilizations or manipulations, that almost never, it's like you're more likely to die from an overdose of NSAIDs than you are to suffer any kind of stroke, manipulation to the neck or a high level mobilization or adjustment to the neck. So they're safer than people think. IPs are taught this in school very briefly. I think that's something worth mentioning too. I took one 3-hour course. It was a lab on mobilizing the thoracic spine. We didn't mobilize the neck. We didn't mobilize the lumbar spine, or I should say a high level mobilization. So we learned how to mobilize, which are grades 1 through 4. There's different varying oscillating forces through the range of the joint. But the high level mobilization that chiropractors will call an adjustment, we learned only for, like I said, the 3-hour course to the thoracic spine only. And that is, I would imagine, a huge significant part of the curriculum for chiropractors. So that would be to address the differences in education with respect to adjustments or manipulations. PTs can, and I have courses on performing these techniques that are taught, and the amount of force used are varied in the courses that I've taken, and I've shadowed DOs and you, and the amount of force that is used varies depending on the patient, but usually a slightly more aggressive used by DOs and some of the osteopathic manipulation that they do, and in chiropractors, and I find to be more effective personally than some of the gentle mobilizations or higher level mobilization manipulations that some PTs use. What is the pop? What happens in the pop? People want to know.
Yeah, give me that crack, people say. So it's, in the most simple sense, it's air leaving the joint. So in synovial joints, so synovial meaning it's like a lubricant, or so a lubricated joint, your body naturally accumulates nitrogen bubbles. So now we're going to get back into why I like manual therapy much better than the adjustment. So if you can imagine, you have two vertebrae stacked on top of each other and muscles attaching the top vertebrae down to the bottom vertebrae. If those muscles are tight, those vertebrae don't move well in respect to each other. So if the muscles are tight, the joint doesn't open, allowing the air to escape. So over time, more and more and more of the nitrogen accumulates in that joint. And then eventually, if you adjust, so you open up the joint really fast, faster than the muscles can guard for, or maybe opening them and stretching them more than they have been recently, you're finally giving that nitrogen bubble somewhere to go, like opening up a can of soda and there's that crack. And that's why most of the time when you crack once, well, you can't crack again until that air bubble accumulates again. So for me, I want to go and make more of, let's fix the muscle that's causing that bubble to exist because of stiffness, and let's fix that. And then if you do that, a grade 1 mobilization, grade 2 mobilization will be plenty to open up that joint because the muscle is now loose, and you don't need to go and do a really hard and fast manipulation that scares some people, or some people love it, but some people, they're scared by it, or there's some concern over those things. So cleaning up the musculature first allows the mobilization or the manipulation to be much easier afterwards.
And that's where you see eye to eye. I think from a soft tissue perspective, you're going to get that is what may cause the mobility of the joint. So let me address that first. And now we find that, now we have improved mobility. There's no need to do high level mobiles or manipulation now that we've improved the mobility through addressing the stretches. What other differences that come for you? Obviously, I think PTs get some education on exercise prescription. In my opinion, not enough. I think we're expected to be experts in exercise prescription, and there's not enough in school. That's something that you learn more so during your affiliations or experiences. They have a high knowledge of anatomy and physiology, but exercise prescription, I feel like, is what we PTs should be great at, and aren't necessarily getting that in school. What are your thoughts on that for chiropractors and for PTs?
Yeah, so for chiros, we don't get any of that. I mean, we have some basic physical therapy, or call it it's almost like athletic training / PT types of work of here's how to use some stim machines, or here's how to do some simple exercises, things along those lines. But it's more of know how to do your stuff, and then if you don't know how to do it, refer out. And so it's kind of limited in that way. And that's where a lot of it has to do with okay, can you take these other courses to know what the other people need? Go back to what you do best, but if you know what the alternatives are and how they work, you'll know how to direct them, right? You'll know, again, with me, when someone comes and asks me, what are some good activation exercises for the transversus abdominis? And I'll kind of scratch my head and I go, well, I remember one, or I know one that I can kind of do, but I know that the PTs are great at it. Go see the PT, they got you, right? So it's having that understanding of who does what, and get them to them, and then come back to what you do well. And so in our school, like I said, we had mostly adjusting, like you had said. We had some supplement types of stuff, like what's the actions of vitamin C or D, or some of the exotic herbs, what does kava kava do, or stuff that's in the alternative world. And then again, some here's some basic, very, very basic, I would consider more PT stuff. Here's some basic exercises. Here's some basic stretches. Here's some basic tools that you may find in a clinic. But I think it's not really in depth, or as in depth as it could be. But you ultimately run into is well, what are we going to be good at, and let's teach that. So It's kind of a tricky one.
I think we both learn a decent bit. I know in PT school a lot modalities. So modalities would be hot packs, cold packs, cryotherapy, electrical stimulation, ultrasound, and so forth. I know chiropractors use some of those modalities. Research doesn't necessarily support a lot of use of modalities for long-term change, but it may help with pain short-term or blood flow short-term. So I think that's worth mentioning as well. Are there any similarities or differences otherwise? And I think we've stated pretty thoroughly that the two worlds should be working together. But are there any other similarities or differences that you're aware of or want to point out?
Yeah, no, I think that if everyone can just kind of know what they do best, and not all chiros do manual therapy, right? And not all PTs do joint mobilization. So I think it's finding a good clinical partner that complements what you do is ultimately what's going to do best. Because there is such a blurred line. Like I think, again, to touch on it again, like I could probably figure out how to use a stim machine, or I could figure out maybe how to do some proprioceptive exercises or muscle activation exercises, but that's not what I do, and that's not what I am good at. But you are, and vice versa is to know, well, patch technique itself is unique, and it's something that I don't have, and I think it works really well. So I'll let Mark or a patch person handle that, and I'm going to do something that I'm really good at. So it's the similarities and the differences that are all physical medicine or physically based, conservatively based, together, that if we both do what we both do together, it will be less blurry than I think it would be even now. But it's, again, having the confidence to know, like, a referral out does not mean I lose that patient and I'm gonna have to shut down my clinic, because that clinical partner I have is gonna feed me with patients that I need. So and that reputation will grow. So it's just finding the right groups, I think, and having good clinical conversations and discussions. And there might be a PT who loves manipulation or mobilization and a chiro who loves the PT. I mean, that could certainly happen. But it's knowing what is it that you want to do in your practice. What do you want to surround yourself with? What kind of practice do you want to run? And stick with it. I think that would ultimately be most helpful.
Amen. This has been an awesome conversation where I think we were able to settle a lot of stereotypes on both sides, Ps and for chiropractors. I say it all the time. Patients ask me, what's the difference between a chiropractor and a PT, or what doing a chiropractor? Now, listen, like, chiropractors are experts of the spine and the adjacent joints. So does that mean they can't work on hands? Sure, they can. So, but they know the spine better than I ever will. So I think if we understand what each chiropractor individual is good at, and same with PTs. I know PTs that are excellent with soft tissue. I know some that are not good at soft tissue work, and they're great at re-educating muscle and activation. I think I would then, physicians ask me all the time, who would you send to for this issue? I know a really good PT for that, or I know a really good chiropractor for that. So I think it all comes down to trust. You got to give it a chance. PTs, give chiropractors a chance. Don't think, oh, when I went to see a chiropractor, don't assume that they were adjusted or manipulated. You should ask the patient, okay, what kind of care did you receive? Or how about this? Maybe pick up the phone and call the chiropractor and find out what kind of care that was rendered, and vice versa. I think that communication, you call it a clinical conversation. That's a perfect way to describe the many conversations you and I had that resulted in great outcome for patients. So we got to be open-minded first and foremost, and I think the rest will go from there. I want our listeners to be able to get in touch with you, Marc. So how do they do that? I know you have YouTube, you got a website. If there's any other phone number, throw all of it out there, and we'll put it on our description at the very bottom of the page.
Thanks, Mike, and I appreciate that. And I want to just, as we're winding things up here, before I give that information, I just wanted to again say of just how from day one, a PT and a chiro synced up great. But it took you to be open-minded, and I came in open-minded, and it was a very good thing. And hopefully more of the chiros who are listening to this and PTs who listen to this will kind of take a step back and look at it and see how we're actually great clinical partners. We shouldn't be adversaries. We shouldn't be anything but great clinical partners who can offer something that most people can't. And I thank you from the bottom of my heart for just being open from that first day and not putting me in that chiro box and talking and just getting to know me as a person and as a provider. And I really appreciated and enjoyed all the moments that we worked together. I really did.
Right back at you. Thanks.
Yeah, people are looking to find me. The easiest way is just go to www.patchtechnique.com. On there, you'll see all the contact information as far as my phone numbers, information on Patch Technique, information on me, and our locations. So patchtechnique.com is the easiest place to go to. And if you ever have any questions, you can feel free to email me directly from there or call me in my office. I get phone calls from patients all the time, from providers all the time, looking for more information. And I just always say, it's like, you're never going to know unless you ask. So ask, and I'll be more than happy to have any type of clinical conversations with anybody out there and be able to share how you and I did this, Mike, because I think that, working together with the PTs, and hopefully we get together or you and I get to work together again in the future. But I think it's the future of our professions is working together and to do something very special.
Absolutely. You work in the Philadelphia area. You also work in Cherry Hill, which is not far over the bridge from Philadelphia. You travel with some band. I forget the name of it again off the top of my head. I'm not sure if you're disclosed that, but you travel, you get around. So I think you're a great resource for people all over the country.
Yeah, I travel around. It's the Zach Brown Band. So if you're a country fan, it's the Zach Brown Band. But yeah, I consult all over the country. I consult for bands. I consult for agents in sports world. So yeah, I have hands and will travel. But if you're ever in the Philly area, please look me up. If you ever want to shadow me, I'd love to have you by and just reach out.
All right, awesome. Thank you so much for joining us. This has been an awesome conversation, and I hope we settled some disputes there. And I agree with you. We should be working together long term. Thanks, Marc. In details, you can get Marc's information.
Thanks, Mike.
Thanks for listening to the On Cue Performance Therapy Podcast. If you like this episode, please subscribe on Apple Podcasts and Spotify. It would mean so much to me if you could leave us a 5-star review so more listeners like you could get this important information. See you next time.